Good afternoon, everyone. Welcome. Europe has never been more fragile than now, and projects like that bring the community together through common goals directed to actual gains for our citizens or patients. Chrodis Plus Joint Action is a 3-year initiative funded by the European Commission and the participating organizations that involves a total of 42 beneficiaries from more than 20 countries. The overreaching goal of Chrodis Plus is to support member states through cross-national initiatives identified somewhere else as part of the joint action Chrodis to reduce the burden of chronic diseases, increasing the sustainability of healthcare systems, and obviously improving the outcomes for the patients. The focus is on tangible transnational activities with the potential to trigger health and chronic disease policies in member states with a perspective to improve the health outcomes. Sorry. And this map here represents just how wide Chrodis Plus as a joint action has been going in terms of implementation, something what actually is being transferred to our patients. If you remember nothing but one slide from my talk, this probably is the one. We are living in great times where there is more and more evidence being published in scientific journals. There is more and more meta-analysis being done. And therefore, there are great ways to find out what needs to be done. There are great practices being identified. And in actual fact, when so much is known, it becomes a matter of prioritization of what we do and what do we start. Having so much information now, it's a very interesting situation that we have such a huge evidence practice gap, which means that we know what we should be doing, but we're not doing it. And actually the gains in closing the evidence practice gap is potentially much bigger than identifying or finding something new. And this is exactly the key objective of the Chrodis Plus joint action, to show that the good practices identified somewhere else can be relatively easily converted, brought to another healthcare setting, another country, and implemented with direct benefit for the patient. So as per this slide, you see that at the very bottom, we have the what we came up with as part of the joint action Chrodis, initial joint action Chrodis, as what we're going to be doing. And the outputs, such as the integrated multimorbidity care model or the recommendations for diabetes quality criteria or national plans, were things we would be working on in this joint action. We then identified what we call early adopters or stakeholders, who were willing to actually get on with the work, implement what we suggested needed to be done. Proving the concept, and more importantly, preparing the concept for the national or regional scale-up. We then, together with our partners, conducted a methodological support, implementation methodology, which would support the implementers to go step by step and being successful in implementation. And then obviously, we got to pre-operation and actual implementation, leading to the citizens benefiting from it. You will hear more from the work package leaders what we've done, but how it transfers to our clients, to our patients or citizens. If we only take 5 out of 21 implementing sites, currently we have over 1,000 patients involved in piloted multimorbidity care model, where all those 1,000 are benefiting from the from the actions we're doing. We have, as a joint action, we have a really wide range of things we are working on. And if we go from the back, we have an employment work package, we have the quality of care work package, we have multimorbidity, health promotion work packages, we have health policy work package, etc., etc. So it's a wide range of things we're doing. Obviously allowing some flexibility for the implementers to adjust to their priorities and needs. But what we have as a key objective is proving that this wide range of very different implementations is actually doable. We have enough things, what we know is working, it's the right time to start actually go on and do it. How we are supporting them is a three-level support. One is the methodological support, which I talked to you about. It's the methodological implementation. They also get the work package leader support and obviously external expert support when needed. Implementation is one thing, but what's next? What's beyond that? Obviously, sustainability is something what we also are really keen about. What we are working now is to have successful pilots, and I believe from what you're going to be seeing, we are succeeding. But this is not enough to have a sustainable change. What we need next is outcome improvements, and this is also embedded in most of our implementations, which means that we are following patient experiences outcomes, we are following clinical outcomes, and also we're going to be working on economical outcomes. And I'm really grateful for the European Commission and OECD for actually joining us to be able to calculate if what we're doing actually is worth the money. And going beyond that, obviously, what we do and hopefully prove that it is not only effective but also cost effective, it needs to come into strategies, strategic goals. And again, the steering committee, which seems to have some interest in what we're doing, might be a way out. So on that note, I would like to once again welcome you. I hope the objectives, which I try to make clear here, are in your heads and will allow you to go easier through the work package content, what my colleagues will be sharing with you in just a minute. Thank you very much.